Hi, my name is Bronwyn, and I chose to do my final presentation on bacterial pneumonia. So before I get really into everything about bacterial pneumonia, I'm just going to do a brief overview so that everybody knows what's going on. It affects the respiratory tract, and it inflames the sacs in our lungs, which are called alveoli, and causes them to fill with fluid or pus. The severity of pneumonia varies. It can be very mild symptoms to very severe symptoms, resulting in hospitalizations and even in some cases death. However, the populations that are affected the most are very young children, the elderly, and then immunocompromised people. And the picture on this slide is image 1, and it shows what the alveoli in a normal lung looks like, and then compared to an inflamed air sac with pus or fluid in it. And they just swell up a little bit. They have little granules in there that get all angry, and so I thought that was a really interesting picture. Signs and symptoms. So before I get into the signs and the symptoms, I'm going to differentiate between what these two things are. Signs are things that everybody can see that the patient has. It's very objective. The patient definitely has a cough because everybody can see that they're coughing. They know they're coughing. Symptoms are things that only the patient feels, like fatigue. That's something only the patient feels, and it's very subjective. So the signs of pneumonia are cough, fever and chills, vomiting or diarrhea, shortness of breath, and confusion. Confusion is mainly seen in patients over the age of 65. And interestingly, where I work, at the doctor's office I work at, we had a patient who is over 65 and he got pneumonia, and he started having some confusion. And I didn't know that that was a symptom or a sign of pneumonia, but apparently it is. But all of those are signs because they're all things that not only the patient and the person who's infected can identify, but everybody around them can say, oh yeah, they're confused. Yes, they're vomiting, that type of thing. The symptoms of pneumonia are chest pain with breathing or coughing, fatigue, nausea, and cold intolerance. And those are all things that only the one who's infected can feel. Very objective. Or subjective. Okay, so the pathogen. So I focused in on bacterial pneumonia. So I'm focusing on the bacteria, the most common bacteria that cause bacterial pneumonia. But just for your information, pneumonia can be caused by bacteria, viruses, fungi, aspiration of chemicals or food. So pneumonia can be caused by a broad range of pathogens. But the most common bacterial pathogens that cause bacterial pneumonia are the Streptococcus pneumoniae, or pneumococcus, the Haemophilus influenzae, the Chlamydia pneumoniae, the Mycoplasma pneumoniae, or the Legionella pneumoniae. Oh, pneumophilia. But the most common is the streptococcal pneumoniae, or pneumococcus. So a lot of research that I did went into the pneumococcus since it is the most prevalent. So, virulence factors and pathogenesis. I focused this in on the pneumococcus since it's the most prevalent, and the two main virulence factors are polysaccharide capsule and the ply protein. The polysaccharide capsule is really interesting. It binds to complement, and so when it binds to complement, the complement cascade is not able to be initiated, and therefore phagocytosis of the pathogen cannot be completed. So the polysaccharide capsule inhibits a lot of phagocytosis. The ply protein is very interesting as well. It gets into the membrane, and it releases all of these toxins that put little pores in the membrane. So So both of these, the polysaccharide capsule and the ply protein, both help the pathogen invade the human body. In this case, invade the lungs. And the pathogenesis of this is through virulence factors, the immune system is inhibited. Because it is inhibited, bacterial cells are able to multiply in the lungs. Along with bacterial cells being able to multiply, a ton of white blood cells are coming into the lungs. As these white blood cells are coming into the lungs, there's all this phagocytosis is being inhibited in some cases, so like all of this stuff is just building up, and this results in the alveoli, or the little sacs in our lungs, being filled with fluid or pus. Regarding epidemiology, and on that previous slide, image 2, that's just a picture of what the Streptococcus pneumoniae bacteria looks like, just for reference. Okay, epidemiology. So this picture, image 3, is the cases of childhood clinical pneumonia. So it's not all pneumonia, but interestingly, I chose this picture because it shows that pneumonia is present anywhere. You can get it anywhere. So that's the really interesting part about pneumonia, is it's so common. It's so common, and there's nowhere that isn't colored on this image. Interestingly enough, I did notice that Africa is the place where pneumonia is most prevalent, and I suspect that that's because modern medicine and modern medical technology has not reached Africa as well. Third world countries in Africa don't have the same access to medical care that we do here in Europe or many other places of the world, so they may not be getting the vaccines and may not be getting the same medical care we do. So I suspect that is why that area in Africa has more pneumonia, but in general, the takeaway here is that pneumonia is common throughout the world, and it affects mostly the elderly and children the most severe, and the immunocompromised. So how do you diagnose pneumonia? The most common way is a chest x-ray. This shows inflammation and fluid buildup in the lungs. And the image 4 that I have on here is a pneumonia chest x-ray. And as you can see on the right side, there's a lot of cloudiness. That indicates fluid in the lungs. By looking at this, a radiologist could say, that person has fluid in their lungs, they have pneumonia. Another diagnostic test a provider could do is a blood test. They could test the patient's blood count and see if they are currently fighting off an infection. If their white blood cell count is elevated, that could indicate they're fighting off an infection. For further analysis, they could also do a blood culture. They could culture the blood and see if the bacterial infection has entered the bloodstream. If this is the case, this would help the provider pick what type of antibiotics to use. In more severe cases, in hospitals and stuff, if someone is hospitalized for pneumonia, many more diagnostic tests can be done, but these are the most common in a general practitioner's. These are the first round of tests that would be done. Treatment. For bacterial pneumonia, it's antibiotics. And the choice of antibiotics depends on the social history, medical history, and age of the person. And so once the antibiotic is chosen, hopefully that will take care of the patient's pneumonia infection, pneumococcal infection. Another recommendation is increase fluids, just like with the flu, with any cold, you want to be sure you're drinking plenty of liquids. And then lastly, they recommend anti-fever medications like Tylenol or ibuprofen for symptom management. Alrighty, and then that leads us to prevention. So there are vaccines developed for pneumonia. They're only against the pneumococcus, which makes sense since it is the most prevalent bacteria that causes bacterial pneumonia. This chart I put on here is really interesting, but I think the takeaway from it is that after age 65, people should get the Prevnar and then the Pneumovax, separated by 1 year. And interestingly enough, at 6 months, when we're all 6 months old, if you get vaccines, you are given the Prevnar. So then you're given that again after 65, followed by the Pneumovax, and that helps prevent you from getting pneumonia. Since so many other bacteria can also cause pneumonia, and viruses and fungi can cause pneumonia, it doesn't mean you're not going to get pneumonia for something else, but it does help prevent against the pneumococcus bacteria. These are my references. If you have any questions, please email me. Have a great rest of your day. Thank you.